England ends free mass testing and COVID isolation laws. Today's video update will discuss Prime Minister Boris Johnson's plan to end free mass testing and coronavirus restrictions in England. A statement by Boris Johnson shows that Rishi Sunak has defeated Sajid Javid in a cabinet battle over funding. Coronavirus isolation restrictions and mass free testing are to be removed from all over England after Rishi Sunak won a cabinet battle on cost-cutting of the pandemic, prompting fears that the needy and helpless will pay the price. Boris Johnson revealed plans to end free testing for the common civilian from the 1st of April, and he said it was time for individuals to get our confidence back. The Prime Minister said the individuals who test positive for coronavirus would no longer have to be isolated by law from last Thursday, and from April will not even be recommended to remain at home if infected. The Chief Medical Officer, Chris Whitty, and the Chief Scientific Advisor, Patrick Vallance, hit a more careful note, advising individuals to keep taking precautions such as wearing masks and isolating while infections remain high. At a Downing Street press conference, Johnson highlighted the necessity to monitor recent variants, with Whitty cautioning that coronavirus could still cause significant problems and warning that it is not a trivial disease. Boris Johnson revealed changes after Sunak, the Chancellor, won his fight to cut the cost of coronavirus testing, which has completed £15 billion in the past year, by up to 90%. The Health Secretary, Sajid Javid, pushed £5 billion to £6 billion to fund more community testing and surveillance studies but failed. After last-minute disputes that postponed a cabinet meeting by more than 2 hours, additional budget will now have to be found from his own department's funding. Number 10 insisted that actions to decrease the NHS waiting list backlog would not be affected. Tory MPs who objected to coronavirus limitations were satisfied at Johnson's move, but it was welcomed with disappointment by some scientists, medics, charities and unions. Many raised concerns that the low-paid will not be able to afford tests and might come under pressure from employers to work when ill with coronavirus. Those on low pay will no more get financial help to isolate if they test positive, and sick pay will revert to the pre-pandemic rules, with eligibility from day 4 of sickness rather than day 1. Charities said the end of free tests was also a setback to clinically weak individuals and older age groups, cautioning that they might lose confidence when going out in public. However, business groups expressed frustration that they would have to take decisions on testing and isolation guidelines for their staff. The government said that a small number of at-risk groups and home care staff would persist to receive free lateral flow tests, probably the over 80s, but Number 10 disclosed the details of who will be eligible, and its funding had to be worked out. Johnson highlighted personal responsibility for coronavirus in future, instead of the government imposing limitations to control it. He said pharmaceutical interventions, such as vaccines and antivirals, would be the primary line of defense from now on. He said they don't require laws to compel individuals to consider others. They could depend on that sense of commitment towards one another. Let's now look at the changes announced by the Prime Minister. Contact tracing was ended recently, and contacts of individuals testing positive would no longer have to test or be isolated. Schools and other education settings will no longer recommend testing twice weekly, with immediate effect. NHS and social care staff will no longer require asymptomatic testing, but this is expected to carry on for patients and care home citizens. COVID passports will be discarded from the 1st of April, with venues no longer recommended to use them. They will still be unrestricted for an international visit. The Office for National Statistics survey of coronavirus in the community will be benefited, but in a slimmed-down version. The Vivaldi study on care homes and panoramic study on antivirals will continue. Although it was unclear how they would be funded, the government demanded whether sufficient testing was being accomplished to support them. At Johnson's first press conference, Since the 19th of January, Whitty and Vallance highlighted that the power to maintain surveillance and ramp up testing again would be critical in future. Whitty worried that individuals with coronavirus should even self-isolate, although the government has not committed to resuming that advice past April. Vallance advised he was concerned about the infection rates once individuals returned to pre-pandemic behavior. Regarding the present situation, he would like the prevalence to be decreased and infection rates to be lower. He said, "They are not back to pre-pandemic behaviors yet." The changes were met with doubt from Labour, who blamed the Prime Minister for cutting sick pay in a way that would hit the lowest paid and the most insecure workers the hardest. Keir Starmer said they couldn't turn off Britain's radar prior to winning the war. Ignorance is bliss is not a reliable approach to a deadly virus. It risks undoing all the hard-won improvements the British individuals have acquired over the last 2 years. Some scientists said it was suitable to unwind the pandemic response. Currently, the Omicron peak has passed. Still, others expressed fears about the outcomes of an abrupt end to free testing. Professor Stephen Reicher, a member of SAGE's behavioral science subgroup, said he was worried that it exacerbates inequalities for those who can't afford to test or self-isolate. He further said that all the rhetoric about liberty and choice about permitting individuals to work on personal responsibility disguises the fact that those freedoms and options are restricted to those who have the means. Johnson's elimination of support for self-isolation and testing takes options away from those who cannot afford to stay indoors or purchase testing kits. He further added that Johnson revealed the error of his argument in claiming that anyone who wants to can purchase a test. No, they can't. Tests are an impossible luxury if you already have to choose between heating and eating. We have reached the end of today's video. If this video was helpful, hit the like button and subscribe to our channel for more updates. Thanks for watching.